was subsequently diagnosed with ADHD-like things. So, in fact, the ratio was almost doubled in those women who were taking that much Tylenol.
Which sounds very significant.
Yeah, it is significant. This is what we call an association. There's no cause and effect here yet. That's something that can sometimes take a long time to find and investigate. But it's a large study. It's a significant finding, and the numbers really are worth paying attention to.
How would, though, a pain reliever, like I said, acetaminophen, how would it actually contribute to ADHD?
The right answer is we don't know, and people who say they know for sure probably don't, but what they think could be happening is that Tylenol could be acting as what is known as an endocrine disruptor. As the baby is developing, the fetus is developing, there are all sorts of hormones that are telling the body to do certain things. Develop this organ, develop that organ, develop the brain. If some of those hormones are disrupted and they're not behaving the way they normally should, the brain that may not be getting some of the signals it needs during some very crucial points of development. So again, that's a hypothesis, Anderson, that we don't know for sure. And this whole study, again, we don't know that there's a cause and effect here. This is just an association.
So I mean, the bottom line for somebody who's pregnant, what should a woman do? Is pregnant? What do they do with this information? Do they stop taking Tylenol during pregnancy?
Here's what I would say, and I thought about this quite a bit. Looking at all the different things that women take Tylenol for during pregnancy. For fevers, I think again, Tylenol is really the best option. It probably is still something that's going to be safe to take and safer than letting a fever sort of go unmitigated. But for things like muscle pain or joint pain, things like that, doing non-medicated therapies, massage therapy, hot baths, these were some of the things the study authors recommended. May sound simplistic, Anderson, but again, you want to try and reduce the amount of Tylenol as much as possible. By the way, we did hear from Johnson & Johnson, the makers of Tylenol as well, and they point out the same thing that I've been telling you, that this is not a cause and effect study. That has not been established, and they say that obviously talk to your doctor anytime you take a medication, but this one's safe to take, they say.
All right. Dr. Sanjay Gupta, I appreciate the advice. Thanks.
You got it. Thank you.
Good.